I am Dr. Patrice Sentino, and I will be lecturing from Addiction Treatment and Strengths Perspective, 4th edition, by Catherine Van Warner and Diane Ray Davis. So, today I would like to talk about certain addictions such as gambling, eating disorders, shopping, and other behavioral addictions. And one thing that's important to know about addiction, of course, we know that substances and misuse of substances often look like drugs and alcohol, but there are some behavioral addictions that also fit into the category of behavioral issues that looks like more compulsive type behaviors. And so these are all addictions that actually share everyday legal activities such as eating, shopping, as I've noted, sexual activity, gambling, surfing the internet, cyber sex. So these are all issues that looks like addictive type behaviors. And what these behavioral or pleasure related addictions have in common is that with the substance dependency is that they can become compulsive and obsessive, as we know. They involve altered states, not induced artificially by a drug, but they alter states of our mind and behaviors. And so they have strong biological, psychological, and social components. Gambling addiction has been around for a very long time. Gambling has become one of the things that has been really socially acceptable. So we have online gambling, we have gambling casinos, and they're relatively social acceptable. But with the obsessive use or the obsessiveness of gambling, it can turn into an addiction. And so the criteria of the pathological gambling is preoccupation, someone that continues to think about gambling, whether it is utilizing their resources, their finances, they take risk in putting their lives, families, marriages, jobs at jeopardy. 3 to 7% of gamblers have problems, and then high gamblers experience suicide or suicidal thoughts. And the reason being is because most often gamblers that are addicted, they lose everything. They risk everything. And so after that high, or they've come down from that high, they realize reality has set in, and they've lost homes, they've lost their money to pay mortgages, they've utilized 401 investments, and so which it often results into suicide. The cost to the economy is $54 billion. We see, like I mentioned, a lot of people go into bankruptcy, a loss of work and time. You see crimes that's committed because they commit crimes to continue to keep that addiction going. Native Americans have a very high rate, over 40% have gambling problems, and research has also shown counties with gambling casinos have higher crime rates and bankruptcy than others. And we often see gambling high amongst elderly. And what happens with elderly population, they have 401k retirement, homes, cars, they lose relationships with family members. Internet gambling is the fastest growing form of gambling today. 2 to 4% in gamblers are in Gamblers Anonymous, are women. Many, and they also have many helplines that are available for people that are struggling with gambling. Gamblers Anonymous is similar to Alcoholic Anonymous. People go to receive support, treatment, a group, and support systems to help overcome this sort of behavioral addiction. Women gamble to escape, and men more often do it for the action, the feeling that they receive from gambling, which is also associated with other problems. And so we know different gambling activities include machine gambling, which is associated with the greatest harm to gamblers. And Scholl talks about how to actually be able to recognize someone with an habit forming behavior, and it's similar to someone with crack cocaine, the crack cocaine of gambling, electronic morphine, and other forms of gambling that really manipulates the mind. And it's the machines, the excitement that manipulates the mind. And most people search and long for that action. Of course, we know that the term pathological gambling is now called gambling disorder in the DSM-4. And some of the symptoms to be able to recognize, according to the criteria, is the need for gambling increases, has repeated success efforts to control, cut back, and stop gambling, has repeated but has been unsuccessful. When someone has jeopardized their relationships, lost jobs, education, career opportunities, or they rely on others to provide money to relieve desperate financial situations caused by gambling. Those are just a few signs and symptoms that we need to recognize when someone is struggling with gambling. And so some questions that we want to ask for screening someone with an addiction to gambling is: have you ever borrowed money in order to gamble or cover loss of money? Have you ever thought you might have a gambling problem or been told you might? Have you ever been untruthful about the extent of your gambling or hidden it from others? Or have you ever tried to stop or cut back on how much or how often you gamble? Some treatment issues. Definitely, when we talk about treatment issues, we want to look at these compulsive behaviors, and a lot of work, cognitive work, is done in motivational therapy. So a lot of cognitive work helps that person with reframing and restructuring the way they think or the way they process that excitement that they feel from gambling. Irrational thinking about winning. And some thoughts, maybe I put so much money into this machine, I'm bound to win. So you have these thoughts that you're ruminating on. High profile winners, lucky machines and dates. So some gamblers, they have irrational thinking that, okay, this is my lucky machine, or these the dates that I should play. You often hear people that play the lottery say, okay, I'm going to play my birthday. This is lucky dates. The state spending on treatment is $36 million, is small compared to the $20 billion in tax revenues for gambling. And when we talk about gambling, we definitely want to consider the neurobiological considerations of gambling. And so the personality trait of making decisions quickly and impulsively is a key marker to gambling and substance use disorder. Those are key markers. Problem gamblers show a reduction in dopamine D2 receptors, and similar to persons with substance use disorders. They also have a heightened level of dopamine release, which is consistent with the phenomenon of dopamine antagonist treatments for Parkinson's disease, and inducing excessive gambling and other risky behaviors for some patients. And genetics is also important to consider and look at, because genetics research has said genetics play a powerful influence on a person's vulnerability to a gambling disorder. And so if someone has a impulsive or obsessive type behavior, then that could possibly be predisposed to other family members. And when we look at internet gamblers are described as also having high rates of gambling disorder. They are more likely to be male, have more education, higher socioeconomic status, and be more technological proficient or savvy, and be more likely to use alcohol and drugs as well. And so if we take a look at some other forms of treatment, we definitely want to look at gender and the comparison in gender. And so research has been done. Small studies have also looked at gender in comparison with versus men and women. And so women are more likely than men to personify a slot illusion of control. And a slot illusion of control, such as believing that conditions such as a choice dealer, this dealer or this certain table, like I kind of said, or this is my lucky casino that I need to go to. Also, some things. So another thing is to consider is flexible attributions, such as transforming losses into near wins, as well as predicting a loss after it has happened by identifying it as like it was just a fluke. But next time I'm going to win. And then we have something called the fixation on absolute frequency. And this is where the gambler measures the absolute frequency of wins. They remember how many times they win, but not the relative frequency, in that they lose more often than they win. And so it's very important when trying to assess someone with a mental or an addiction to gambling. Now, if we move over to eating disorders is one thing that is considered behavioral. And so the only one that's related to substance is food addiction. And all others, for example, internet addiction, are behavioral. Oftentimes, clients in treatment for another disorder. And so eating disorder starts in the brain. It's really an emotional state that starts in the brain. And so even when looking at genetics, is seen as a major factor in the development of these conditions and in epigenetic phenomena. And so epigenetic refers to how environmental factors are associated with diet or obesity and nutritional imbalances, and how they may cause changes in the cell functions in the body, including the brain. And so there's been a lot of research around that. 90% of anorexia and bulimia are found in females. It begins typically in adolescence. And so during that adolescent period, a lot of times body image is important. Body dysmorphia is looked at. Females or adolescent girls are not pleased. They have a lot of peer pressure, or what they see on TV kind of influences what should be the perfect body. And so out of that, a lot of these disorders can develop. 0.5% of girls or women are anorexic, and 1 to 3 are bulimic. And so it's important to also look at social factors that play a part in that as well. When we look at anorexia, refusal to maintain a minimum normal body weight, and fine body hair is something that's identified in someone that has anorexia. And so we have many different levels. We have anorexia, we have bulimia, we have binge eating. Binge eating is also a disorder, and it's one of the 3 disorders most clearly related to other substance use disorders as well. And so binge eating can be led to morbid obesity, and therefore it can be life-threatening. 10% mortality rate, often by suicide, correlated with perfectionism, ritualism, high anxiety, low self-esteem, family history of depression, and then related to obsessive compulsive disorder. And so most of these behaviors look like a compulsion. And compulsions are repetitive behaviors, such as washing your hands, cutting the lights off, and often associated in the public mind with obsessive compulsive disorder. recurrent persistent thoughts, or ritualistic practices. If we begin to look at bulimia nervosa, this is another eating disorder. In bulimia with alcohol, we see a lot of clients that bulimia with alcohol misuse, 30 to 70%. 35% of bulimics experience childhood sexual abuse and the use of food as a drug. And so their way of compensating or dealing with those emotional hurts is food. And so we see that in a lot of sexual abuse cases. We see where as they grow up in their adulthood or during adolescence, they use food as a comfort. New studies show a lack of dopamine receptors in the brain of morbidly obese people. So there's more research that's being done and connected with that. And so women who develop bulimia may have a history of weight gain or come from a family in which overweight is a problem as well. And so we see binge eating. The National Institute of Mental Health as reoccurring binge eating episodes during a person's life is that they're losing control over his or her eating. And so unlike bulimia, binge eating episodes are not followed by purging or excessive exercise or fasting. And when we talk about treatment interventions, some selective serotonin enhancing antidepressants have actually been found helpful for bulimia, such as the medication called Zofran. And this is a drug that's normally given to cancer patients and others to prevent nausea, vomiting, which has also been found to work effectively with bulimia. We've also seen cognitive behavioral therapy has been effective. And some debate is the cognitive behavioral therapy, is it more effective than utilizing antidepressant medications? And so we've seen where co-treatment, the behavioral and the psychopharmacological treatment has been used. Bulimia cognitive treatments, avoid strict dieting. You want people that have suffered or have been diagnosed with bulimia to avoid strict dieting. Anorexia, Prozac is effective in reducing compulsive behaviors, but only when weight has been gained. And then men more or less suffer with muscle dysphoria, and antidepressants may help here too. So men kind of look at their body image as well. And so you see a lot of men that may bulk up, they want to take steroids. And so you see that being in their own mind that maybe they're skinny or their physique is not what it should be. And so that is called muscle dysmorphia. And so antidepressants have been utilized to help with that as well. Midlife eating disorders are prevalent and often overlooked in groups of women over the age of 50. A lot of times at that state or age, there's midlife crisis, and sometimes men and women are not happy with where they are in life, and so they begin to indulge in eating disorders, become emotional eaters. And so we also have Overeaters Anonymous that has been utilized to help as a form of treatment as well. A group treatment teaches moderation. And so here, once again, cognitive behavioral therapy. If you can change the cognition of someone, you can definitely change their behavior outcomes. The theme of neuroplasticity. Neuroplasticity is that as long as we continue to learn information, our brain continues to grow. So brain neurons can form new connections. So as old brain cells die off, new brain neurons and new brain cells grow. As we continue to expand, our brain continues to stretch. and gain new information. And so this is brain lock, can be corrected. And so where we think our brain is locked at a certain place, the theme of neuroplasticity, as long as we're learning and taking in new information, we begin to unlock our brain, and our brain begins to continue to grow. If we move on to shopping and spending addiction, this looks like compulsive buying disorder. And so this term is by foremost used as medical authority on spending. And so here, most like some of the other addictions, behavior addictions that I've already talked about, looks like compulsive behavior, compulsive shopping, impulse control. And so, and this is a way of, has a way of igniting the pleasure principle within our brain. And so typically 31-year-old females who have overpresented for 13 years, research has shown problems in about 2 to 8% of people. And the DSM-4 also lists kleptomania as one of the symptoms to kind of identify someone. Medications, Luvox is a medication that has also been utilized. And these medications more or less triggered certain neurotransmitters in the brain, and so it really looks at the impulse control, in controlling impulsivity. Debtors Anonymous groups also have sprung up to also help one to deal with these different types of addictions. Hoarding is also another disorder, and hoarding is really characterized by the persistent difficulty in discarding or parting with certain possessions, and it becomes problematic. Now, if we look at cyber addiction looks at the internet. Internet addicts, they become preoccupied excessive amount of times, involved in chat rooms, playing games. We know internet gambling is an addictive disorder, jeopardizing relationships. It's a fantasy world because it's really not realistic, especially if we're in chat rooms or we're on different sites. It's the fantasy world. It's fictitious names. We see people that have also jeopardized their jobs because of going to inappropriate internet sites on their jobs. And it has to do a lot with self-efficacy for empowerment. Korean government training psychiatrist really has provided some research on how to help treat people that deal with cyber addiction. If we talk about frames, and frames is how do we take a cognitive approach in how do we overcome some of these destructive behaviors and beliefs in someone that's dealing with these addictions. So feedback, assessment of use, responsibility, the choice is theirs, making sure they know that the choice is theirs, putting that responsibility back on them. Advice, set goals together. Minus of self-directed change options. So maybe that looks like monitoring your computer use or internet use. Empathy and self-efficacy. Also, we also want to consider harm reduction strategies. And so with the internet, maybe it means get a timer, maybe stay on the internet a certain period of time, putting some restrictions when visiting certain websites, or cutting your mailing lists out, or no detours. You're on this site, you're looking for something, and maybe something pops up, and then you detour off to another site. Also, self-talk is a positive way of reframing the way you think and bringing awareness to some of that self-destruction behavior. Also, if we look at sex addiction, let's talk a little bit about sex addiction. In sex addiction, these are often people that are categorized as risk takers. Cognitive behavior therapy, once again, is recommended as a form of treatment. Research has indicated that they're prone to lying. One TV broadcast looked at President Clinton's background and his sexual risk taking. However, others disagree. The case with Tiger Woods. Self-help groups have also been, these are just some examples, but self-help groups such as Self Addicts Anonymous is another tool that's utilized for support groups. Cognitive therapy. Cognitive therapy helps to reduce some of the distortion, especially with these addictions and anorexia. Distortions about body image or how someone sees themselves. It has a tendency towards to address extreme behaviors. And the slogan is AA, easy does it. And so making sure that it's easy to restructure and to keep in mind that these are behavioral addictions, and these behavioral addictions have to be addressed with behavioral techniques. Rational recovery, such as emotional enhancement therapy or rational emotive behavioral therapy, have been more adversarial because they're more of a confrontational type approach, and they focus on current beliefs. But sometimes we have to go back to old behaviors or old beliefs that someone has told themselves, or some acts that have been committed against a person, such as sexual behavior, sexual abuse. Cognitive therapy teaches clients to avoid black and white thinking. So there is always another way to approach a situation. It's equifinality. It's always one way to skin a cat. Ask about times when clients successfully handle a problem. So you definitely want to make sure you're looking at a strengths perspective approach. What have they done in the past and been successful, and leverage that. Use regular assessment for disease addictions. Feeling work, positive reinforcement, and reframing. You want to always use positive reinforcements. You did this, and this was the positive outcome, so reward yourself. Stress management, modified thinking, exercises, group work, artwork can reveal underlying feelings, such as art therapy has been utilized to be effective. And then positive reframing, self-talk. Get someone to begin to reframe that negative talk. I am an addict. No, I am an overcomer of this addictive behavior. I look great to overcome negative body self-image. Cognitive therapy can be directed towards the past as well as the present. So not only are you focusing on the here and now, but it can look at how you looked at certain situations in your past. Feeling work. Anger management, anger as a cover. Sometimes anger management is needed because sometimes people are angry about certain things that has happened to them. Avoid all or nothing thinking. Stress management, some practical things: drink warm milk, use self-talk, get exercise, get some vitamin D, group exercise, art therapy, grief for losses, being assertiveness, treatment. And so these are all some things that we definitely could look at to help address the pathology of gambling, eating disorders, sexual addictions. And so this chapter really want you to take a look at the pathological and the neurobiological effects of how these addictions play a part on the body, epigenetics, brain chemistry, and looking at practical ways to provide treatment and overcoming and working with someone that's struggling in these areas of addiction. Thank you.